Welcome to Inside Aesthetics, the world's leading podcast for aesthetic medical practitioners and injectors. I'm Dr. Jake Sloan, a Sydney-based doctor, speaker and trainer with over 17 years of experience.
And I'm David Siegel, an aesthetic business entrepreneur and mentor with over 20 years of experience in our industry. Our podcast is aimed at medical professionals only, and we share industry insights from leading experts. Our podcasts are general in nature and should not be used by prospective patients for any medical advice or treatment decision-making. All patients should have a consultation with a medical professional and have a bespoke consultation before proceeding with any treatment.
You can also subscribe to our Patreon for on-demand educational content, videos, business coaching, and networking with over 350 other injectors from around the world. The traveller returns.
I'm back. It's been
I feel like you left me.
I've gone for a month.
Yeah, that's highly unusual.
I know. Normally I'm the one that stays here and you're the one that's traveling, but you're about to travel again.
Indeed. So I guess that has an impact on podcasting and when things come out. So this podcast, we don't even know when it's coming out because this is the only window we've got to record something before I go away. But hopefully we can get that out this Friday, which will be, I think it's like the 27th of June. If not, it'll be the week later. So sorry, guys, but there definitely will be a period where there's 1 or 2 weeks where there's nothing. So you'll have to amuse yourself.
Absolutely.
And then we'll be back. We've got a whole heap of stuff planned for the near future, so we'll get recording again. But anyway, we all need holidays. How was your trip?
It's great. So mainly pleasure, and then it was over in Europe. So Switzerland. I'm broke. I've been to Switzerland now. I've not got no money left.
$19 a coffee.
$19 for a coffee. It was great. It was beautiful. Went to the Swiss Alps, went across Germany, and then ducked across to Sweden to present at BTS conference, which was great. It was my first international conference as a speaker. So it was awesome. They looked after me really well. It was a big room, probably the biggest room I've been in, and 3 big screens behind you and some big hitters in the audience. So it was
awesome.
Yeah, it was great. It was really good, and met some great people. Caught up with some old colleagues that you and I are friendly with, and it was great to see how people do things in other parts of the world. I've been to INCAS before, but not for a long time. But it was great.
So Beauty Through Science conference.
Correct. Yes.
Awesome. And we may even get some people on from that conference in later podcasts.
Yes. And what are you going? You're going to Dubai?
I'm going to Dubai for a family holiday, and then I get back for 1 day, and I'm going to Hong Kong with Allergan for some training. So it's a bit crazy at the moment.
Well, hopefully there's no bombing while you're away.
Look, it's pretty crazy what we're reading on the news. So hopefully we'll be okay. Yes. I've been checking all the flight paths and stuff. So far it's all fine. But let's hope we're safe. Anyways, but just saying that we have no content for the next couple of weeks. If you've missed them, we've had 3 bonus episodes over the last couple of weeks with Fresh Clinics. So check them out. The cool thing is you can also watch those on Spotify or YouTube. So we've done some videos. So check them out. Now let's introduce our special guest. We've got Dr. Lisa Dinley all the way from the UK, but you're not in the UK at the moment. So
no, I'm currently in Crete.
Yeah, you're in Crete. So you're on a family holiday or?
Just with my husband, getting away for a few days. So just chill without the kids.
Yeah. Very nice. So Lisa, you're one of our Patreon subscribers. You've been sort of in and around the podcast for a few years, but tell us about yourself, introduce yourself to our listeners and your background.
So I've been a dentist for almost 30 years, which I can't quite believe. And I've been performing aesthetic treatments for about 18 years. It was started off, as most of us, a bit of a hobby, alongside things. I was very much kind of like more a functional dentist, rehabilitation, that kind of thing. And I was always, I'm not going to be one of those who does things for cosmetic reasons. And it was my patients who actually persuaded me to, carry out more and more treatments. And so now I'm purely aesthetic. I don't really do any dentistry anymore. But that has led me on to quite a journey in terms of developing sort of more like a holistic, regenerative type approach to my treatments. And that's where I kind of sit now.
Yeah. The whole dentist-doctor debate, it's sort of can be quite, depending on where you are in the world, it can be a little bit controversial. I've heard both sides of the discussion. We had Professor Bob Kana on many, many years ago, and he was talking to us about all the things that you guys do as dentists that I guess give you a lot of advantages in terms of, working within the mouth, working with needles in the mouth, understanding the facial anatomy. But what's your perspective on that? Obviously, you're biased being a dentist, but in terms of, do you think that those skills as a dentist help you in the aesthetic space?
Absolutely. It's even down to how you hold your hands, how you hold your syringe, kind of rapport with the patients. I think because from straight out of university, we have to develop that relationship or learn how to develop that relationship with patients, because nobody wants to come and see us as dentists.
You've got to work on your personality straight away.
Yeah. So we have to very quickly learn how to build that rapport. And I think that serves us very well, because it then, even in performing aesthetic treatments or recruiting patients as your aesthetic patients, it becomes a lot easier and almost second nature. That's without the practical injecting skills as well, I'd say.
Mm-hmm. Yeah. I think in the UK, it's very normal for dentists to be doing aesthetics. I mean, everyone's doing it. It's no one bats an eyelid, but here it's still certainly...
Yeah, particularly in like Victoria, for example.
Yeah.
I think there's certain parts of Australia even where it's more difficult. So
yeah, and I agree with Lisa. I think that you guys have got the bedside manner. It's kind of the same thing. You've got a bed. You're seeing 10, 15 patients a day. You're working with their face or their mouth. It's second nature to you. Whereas, for a nurse off the ward or a GP where you're sort of not doing those sorts of things every day, it's different.
Yeah, totally.
So kudos to the dentists. So, premise of today's topic, we're going to be talking about a new product that has launched in the UK called, and I'm going to get this wrong, Juvelook or Lenisna, depending on where you are in the world and what sort of form of the product that you're using. So, Lisa, can you explain what this product is, first of all, and I guess its naming, first of all, so we don't get confused?
Yeah, so you're right. In the UK, it's Juvelook and Lenisna, and they're sort of siblings of each other. Lenisna is kind of like the older sibling. It's more robust. It has more kind of particle content. So they're a fourth generation polylactic acid. So they're PDLLA, which is poly-D-L-lactic acid. So a bit of a mouthful. They also contain hyaluronic acid. So 85% of the PDLLA and 15% hyaluronic acid, non-cross-linked. The Juvelook as 42.5 milligrams of the PDLLA, and the Lenisna 170 grams, or milligrams rather. And so that's more for your volumizing structural type treatment, whereas the Juvelook is placed within the dermis, within the skin, and is kind of termed, people bandy around sort of skin booster, but it's kind of like more of a hybrid dermal biostimulant, if you like.
It's confusing, isn't it, that terminology, biostimulator, bio-remodeller. We've had some discussions recently, I think as most recently as episode 304, we spoke about it. What's your sort of understanding of the terminology differences between biostimulator, bio-remodeller? So you're right. So they all kind of aim to do the same thing as well, which is even more confusing and can be confusing when you're even talking to patients about which treatment to choose. But essentially, it's using your body's own power to rejuvenate and regenerate the tissues. And biostimulators then form kind of like this part of the umbrella of regenerative aesthetics. And so they're just part of it. So even though they aim to regenerate things, it is just part of that wider aspect.
Mm. Who makes this stuff? I understand it from South Korea, but in the UK, I understand distributed by a company called Fillmed. We know Fillmed. Yeah. So, sort of who are you working with, I guess, and when has it launched in the UK?
So Vaim are the Korean company behind the product, and they've been around since 2014. In 2017, they had the first approval of the Juvelook and Lenisna products, and they're now available in over 70 countries. There is FDA approval as well for the States, and is considered as generally recognised as safe product. But in the UK now, Fillmed have the distribution for Juvelook and Lenisna, and I think that we'll start to see a wider kind of distribution from there.
Right, fair enough. And just, I guess it's worth saying it is available here in Australia. Mm-hmm. We saw that launch about 2 months ago.
Mm-hmm. Yeah. Okay. I was just going to say, in terms of like all the choices that you as an injector now have in your cupboard, and I think there's some confusion, particularly for maybe more inexperienced injectors around which product do they reach for what indication. So What's your sort of thought process in terms of selecting this product for a particular use? Like what are you looking for? What are your indications and how do you choose this over all the other options you might have available?
So indications for the Juvelook product, so like the younger sibling, if you like, would be a younger patient sort of who wants to have like a preventative stimulation or regenerative solution for the skin, finer lines and wrinkles, indicated for the periocular and perioral regions. And by that, I mean the white part of the lip, not the actual red part of the lip. But safe to use in those areas without causing any undue concern. And so that longer lasting than other products. So I quite often get asked, because polynucleotides are such a buzz at the moment, and or exosomes, in speech marks, if you like, but why would you choose it? Basically, the PDLLA or the Juvelook creates more stimulation of collagen, essentially, than those other products. If I had somebody who had inflamed skin, for example, I might use polynucleotides first to calm the skin down and then use this product. For the Lenisna, for the more grown-up version, is more for your kind of middle-aged, volume loss, very atrophic skin, really badly sun damaged. And that really not only creates volume, similar to products like Sculptra, but it also helps to stimulate the dermis as well. And so you get healthier skin as a result. And you can layer these products on top of each other.
So my understanding with Lenisna stroke Juvelook is that it's a hybrid biostimulator, just to get the terminology even more confusing, because it's not just a biostimulator, it also comes in hyaluronic acid mixed. So why do they do that? And what's the purpose of the hyaluronic acid?
So the hyaluronic acid acts as a bit of a carrier for the PDLLA, but it also helps to modulate the inflammation that occurs within the tissues. So you're not getting, an overstimulated response that would create fibrosis within the tissues. So it helps to calm and control that, as well as allow it to integrate a bit more naturally.
Okay, so a bit analogous to Radiesse, where it's in the CMC carrier. The Juvelook is, the PDLLA granules, if you like, in a hyaluronic acid carrier, and it's non-cross-linked.
Non-cross-linked. So okay. You get an immediate boost of hydration, but obviously that's temporary and transient, but it's just enough to control that inflammatory process.
Mm-hmm. So you mentioned, Lisa, that it creates collagen. Well, that's the aim of all these products. What type of collagen, though, is it downloading or creating, because we all know not all collagens are created equal. Some are better than others. So tell us more about that.
So it's type 1 and type 3 collagen. So the way it works is initially we get macrophages as part of the inflammatory response coming to the tissues. Those macrophages have what's called M1 polarization. So they're the inflammatory type macrophages. But with this product, the way it's made, it turns those macrophages into M2 type. So it changes the polarization and then becomes anti-inflammatory. As a result of that, we start that regenerative process with something called transforming growth factor beta. Initially, we get transforming growth factor beta 1, which is similar to what we get with Radiesse, for example. But quite quickly, we also get transforming growth factor beta 2. And we need that shift. So although the transforming growth factor beta 1 starts that regenerative process, if it doesn't shift into the transforming growth factor beta 2, that's when we can dump a load of the fibrotic type collagen. So we get nicer, kind of more youthful, bouncy type 3 collagen through that process. The other thing it does is it also strengthens the kind of like dermal epidermal junction in that basement membrane zone. And so we also get type 4 and type 7 collagen forming as well.
Can you break those types down? I don't know if you can explain that in any more simple way for people, because some people get really caught up on types of collagen and what's the difference and, is it important? So why type 1, 3, 4, and 7? So
it depends where in the tissue layers those collagens are. So we have 28 different types of collagen throughout our body. The most abundant in the dermis are type 1 and type 3. And both work equally well together. And we want some type 1 because we want some tightening. We want lifting. We don't want lines and wrinkles. But if you liken it to a scar tissue and it's really fibrotic and hard to break through, that's what, if you have too much type 1 collagen, that's what happens. And so although you can have tightening, it's not very healthy skin. Whereas type 3 is a bit more youthful, bouncy, creates a little bit more volume. And so we get more of this, what's called like a pan regeneration effect. So we have more of all the types of collagen that we want. But also what's important, we often overlook the epidermis and the dermal epidermal junction, concentrate on the dermis. Whereas if the epidermis isn't in a healthy state or that dermal epidermal junction isn't, then, we can end up having fragile skin, even developing lines and wrinkles, but also things like issues with, hyperpigmentation, melanin actually leaking through that dermal epidermal junction, through that basement membrane zone, whereas collagen type 4 and 7 are integral to that part as well. So it helps strengthen that part.
Okay. What about elastin? That's important. So does this upregulate elastin?
Yes, it does. It does it through that anti-inflammatory effect of switching that macrophage polarization. And so when that happens, it switches off one of the pathways that causes the extracellular matrix to break down, which also upregulates matrix metalloproteinases, which breaks down elastin and collagen. And so by switching that pathway off, it helps upregulate collagen and elastin production as well.
Can I ask what a macrophage is?
Go on, Lisa.
It's one of our immune cells that comes and basically gobbles up foreign material.
Right. Okay. And how does that work in this process? You were referring to it a lot. I just didn't quite understand.
Yeah. We're introducing the product, which is a foreign body. Right. So our body reacts by coming to break it down. And as that happens, it creates an inflammatory response in the tissues. And that's when we get the collagen being made as a result of that.
So the immune system trying to get rid of this foreign body then creates the collagen.
Yeah.
And how do they actually control what collagen's made? So if you're just putting the stimulus in the body, how do they actually selectively work out which collagen types are going to be stimulated?
Yeah. Well, this is where it comes back to, if you have too much inflammation, if you can't control that inflammation, that's when you get the fibrosis occurring within the tissues.
Right.
Which happens if, in inflamed or inflammatory conditions anyway. So if you think of sun-damaged skin, aged skin, even our organs and tissues in the body, if we don't look after ourselves, or as we get older, we get fibrosis within the tissues. So that's why this product's quite unique in that it helps control that inflammatory process. So we're not getting too much happening all at once.
Would you get any differing responses from certain individuals depending on their age or how much existing inflammation's already in the skin?
Yeah, so that's an important point actually, and also patients who have things like autoimmune conditions, who do have to be really careful as to how we're stimulating the immune system in those individuals. So if I've got somebody who's old with fragile or inflamed type skin, then that's when I may use something like a pre-treatment with polynucleotides, for example, to help control that inflammation that's already there, so we don't overstimulate the tissues.
Yeah. I guess that kind of ties in nicely to, what we've been talking about on the podcast for a while, is that importance of overall health of the body being in a much healthier state, trying to downregulate inflammation, because your products are going to work so much better.
Yeah.
Yeah.
100%.
Yeah.
Going back to your macrophage thing, I used to think of it as Pac-Man, gobbling things up.
Right. Okay.
Yeah.
So there you go.
Yeah, that's actually the image I have too.
Like Switzerland swallowing up my bank account.
Yeah.
Lisa, important question just to clear up. PDLLA versus PLLA. Now, we've had Sculptra for 20 plus years now, which is PLLA. So what's the difference?
So PDLLA, also Juvelook, has the D and L form of the lactic acid. So they're basically the same product but mirror images, so a bit like your left and right hand. Mm-hmm. But what they do, they put in like a random sequence in the product, and they create a more amorphous product with more contact surface area with the tissues. So it's easier to inject, it's more flexible, less crystalline. So you're less likely to get clumping and lumps and bumps forming within the tissues.
Yeah, I was reading about the actual particle size and shape and makeup of the PDLA particles, and that sounded interesting. Why is that relevant?
So they have this spherical, foamy structure on the outside. So again, that helps with sort of like a contact surface area, but also is smooth. So it's not like shards and sharp particles causing too much inflammation in the skin. But the inside structure is like a foamy structure. And so that allows for like an ingrowth of the new collagen that's being formed within that sphere. And so it acts more like a scaffold, which is kind of what you want from a regenerative product.
Yeah. And I was also reading that it eventually breaks down in just to water and CO2 eventually. Yeah. So that's kind of a nice thing to explain to our patients, because, a lot of our patients are fixated on things being left in their face for years and years, and they don't like that sort of thought, even though it might be benign. So just a nice thing to, I guess, to explain to patients. Is that true?
Yeah, it is. It's completely biodegradable. So like you say, it doesn't, that's good from our point of view. Sometimes you might think, I want something to last, a long time, but the effects last a long time. So for Juvelook, so into the skin, you're looking at about 12 to 18 months. And for Lenisna, more like 18 to 24 months.
Perfect. Now, you would have heard all this hype by American plastic surgeons about products like this, so biostimulators, and they're kind of a bit anti it. They don't like the idea of all this collagen and scar tissue, inverted commas, being made. So is that a potential issue for products like Juvelook and facelifts in 10 years' time?
I don't think so. And I don't want to, obviously not being a plastic surgeon myself. However, when I speak to a plastic surgeon that works alongside me at my clinic, for example, for him, things like that aren't a bother. He's very experienced, and he's like, no, that's fine. He doesn't mind what's actually in there. So I think it's a matter of personal opinion. But for me, I don't see it as a bother.
What do you think of that argument just generally? I mean, you would have used Sculptra in the past and maybe other ones. I know in the UK, you've got something called Lanuma, Gelane. You've got tons of stuff. So what do you say to your patients about, potential consequences, or is it not something you really consult about?
Yeah, so my patient demographic are middle-aged and over. And so surgery is certainly an option for a lot of them. And, they may well opt for a surgical approach. I always give them the option of a referral. But also a lot of them don't want that downtime or aren't quite ready for surgery yet. So treatments like this for them are kind of what they want. I mean, I've been, even treating patients who, and I know you probably have a similar opinion to me, Jake, when we look on, through the Patreon chats, patients with quite badly sun-damaged skin. My go-to would be go and have ablative CO2 laser. Don't waste your money on anything else. Yeah. But some of my patients have been choosing these products because they don't want that downtime. And I've been quite surprised with, obviously I don't like overpromise or anything, but I've been quite surprised at the rejuvenation that I've seen. But saying that, ablative CO2 laser would still be my preferred option for them.
Yeah. Okay. So where are you using the product? Like, what are the indications that you're primarily targeting when you're potentially going to be treating someone with this product?
So with the Lenisna, sort of temple, mid-face volumization, jawline, older patients with really bad skin, you can use the Lenisna in the neck, you can use it all over the body. In the face, you have the option of reconstituting it to either 10 or 16 mil, depending on the volumization that you need. So that's quite good because you can play around with the ratios a little bit. For the Juvelook, more superficially, I do layer Juvelook over Lenisna if somebody's got quite bad skin and quite depleted volume-wise. The Juvelook you can use around the eyes, as I said, also perioral areas. You can even, because of the way the product's made, because it's not crystalline, you can even use it in the highly mobile areas, sort of like nasolabial folds, marionettes, quite safely, unlike some of the other products.
Sorry, so you said Reconstitution. Is that both products?
They come as a powder.
Right.
So you reconstitute them with, like the other products, with saline, be able to inject them.
So that the HA comes in crystalline form as well?
Yeah.
Okay. And so what's the sort of viscosity of the product? I guess, does that change depending on what sort of volume of diluent you're putting in?
Yeah, so Lenisna, it can be a bit stiffer because there's more of the PDLLA particle within that. But it's still very easy to, you cannula only for Lenisna, just to make sure you are in the right depth. And for Juvelook, it's very, very easy to inject. Only cannula in the periocular area as well with Juvelook. And I would only ever use a cannula 25 gauge and bigger, nothing smaller. And then you're being safe. But it's very easy. It's a very easy product to administer. And, it gives some really, really nice results as well.
So are you using this product similar to how you would use, say, a product like Sculpture, where you're effectively using it as a fertilizer and you just sort of, it's not really super artistic. You're just sort of placing it in the right spot and then the product does its magic? Or is there sort of with the HA, is there some sort of shaping and molding and, what's like?
Yeah, so you do get especially with the Lenisna initially, because again, that's got more hyaluronic acid in as well. You can get a lot of swelling afterwards because you get a lot of water attraction to the area. It only lasts a couple of days, but so you don't want to over fill the patient with that. The treatment recommendation, again, depending on the amount of volume loss, would be 3 treatments, 8 weeks apart, Lenisna, and for Juvelook, 4 to 6 weeks apart. But if you use them both together, you need less of the product, and also less treatments.
Okay, if we could drill down and just make this explicit. So Lenisna is for volume, temples, cheeks, etc. And that's going to be mixed up with 10 or 16 mils of either preserved water or preserved saline or normal saline. Yeah. And you've also got to mix it on this vortex thing, I've heard. What is that all about?
So you can do that if you're just mixing it on the day, which is what I do. So then, you haven't got to worry about pre-preparing it prior to the patient attending for their appointment. And so it's 30-minute mix on the little vortex machine. Mm-hmm. But you can reconstitute it the day before and give it a shake manually. But I prefer to reconstitute on the day and mix in the vortex. The aim is just to get a sort of milky-like appearance, so you don't want to see any particles floating around in the solution. And as long as you've got that kind of reconstitution and it does look like milk, then you're fine.
Okay, and then so let's say you've got 16 mils of Lenisna made up, ready to go. What size cannula did you say? 22?
25.
Yeah, a 25 or 22 gauge cannula. So again, you might be looking at sort of volume-wise, temple. You might be looking at putting between 0.5 to 1 mil, preauricular area, again, 0.5 to 1 mil, depending on the patient. You might be doing jawline.
Yeah.
You can put it, more medially in the cheek as well. You can use it on the neck, hands, so.
And this is all subcuticular plane, sort of fanning it through, covering a wide area.
Yeah.
It's like 16 mils, that's a lot. So
it's a lot.
It gives you,
which is why you can do the 10 mil as well. Yeah, okay, it's quite a lot.
Yeah. Is there a risk of the 10 mil of more lumps, granulomas? Because everyone's scared of the old stories back in, the early 2000s of Sculpture and getting granulomas and it not being diluted properly. Now, I know that Galderma have obviously, basically sorted that with a bigger reconstitution volume and that's sort of a thing of the past, but it's still the thing that people talk about and worry about. So, yeah, is that something, a risk to make it more concentrated?
No, so with Lenisna and Juvelook, the glass transition temperature, so the way the product's made, is at a lower temperature compared to some of the other biostimulators on the market.
Right.
And so if you ended up with an inadvertent lump, then applying heat through energy-based devices disperses it, because the glass transition temperature is, when it's reconstituted, is below 40 degrees Celsius. So it's around 37 to 39.
Right.
Unlike something like sculpture, which is around 60 to 65 degrees. So by applying heat to it, will disperse the product.
Well, since talking about complications, obvious one to talk about would be the old occlusion. Now, you mentioned can be quite a thick product, so I'm assuming there is a risk there with that.
Yeah, well, I think everybody's aware of the case from the influencer who went to Korea for treatment. Obviously, not being there, it's hard knowing exactly what happened. It's hard to comment. She did complain of vision loss at the time of treatment, but treatment was delayed allegedly because they'd mixed with some local anaesthetic and said it was the local anaesthetic that had caused the visual disturbance. But it's, and again, allegedly it was Lenisna. So in Korea, they call it Juvelook volume, that was placed in the periocular area when it's not indicated for that. So it's hard to know what happened, but I think if you use the product, the right product in the right amount through the right technique, the actual risk is very, very low. Same with sort of any injectable product.
Yeah, I'm glad you mentioned that, because some of our listener questions were asking about that, and it's not fair to blame a product because something happened in another part of the world where we don't really know the circumstances, how it was done, but we certainly know that she was allegedly ignored and they said you're fine. And then by the time that she actually sought emergency help, it was too late. So it's a really sad story. But we don't know the circumstances. But let's just say, you're treating your patient and you saw some blanching immediately. Obviously, you're going to stop and maybe look for your hyalase. But is it a dissolvable product? I mean, I know there's some hyaluronic acid in there, so potentially or partially. But what's the recommendation for those sorts of emergencies?
The recommendation would be to kind of flood the area with saline or hyaluronidase, because that helps anyway, and apply heat to that area to break the particles down. If there was any sort of worry about something like vision loss, then straight to the emergency department, get checked out by ophthalmology, hyperbaric oxygen, that kind of thing. So, but obviously, this product or these type of products aren't for novice injectors. So I think that needs to be made clear. It's not something, if you're new to injecting, that you would, think about using. And it's, being mindful of where you're injecting, how you're injecting it, definitely is much safer than worrying about dealing with a complication.
Yeah, that's a good point about which injectors should be trained on this product. So, what does advanced mean? I mean, probably proficient with a cannula, obviously probably several years of experience under their belt.
Yeah, so it is practitioners and only healthcare practitioners who have been practicing for, a few years, couple of years maybe or more, cannula proficient, because you need to use cannulas to use these products.
And then you mentioned about how many sessions you need. So is it the same for both Lenisna and Juvelook? I think you mentioned 3 sessions spaced a period of time apart. And also, when is the patient going to start noticing anything between these sessions?
So you do get an immediate result from the hyaluronic acid, but literally within 2 to 3 weeks, you start to see that stimulation within the skin. I've been doing some cases where, I'm recording baseline images on my skin imaging machine as well. And so I can objectively, not just subjectively, look at skin improvements. And certainly within 2 to 3 weeks, I'm starting to notice, softening of lines, skin textures much better. redness within the skin's reducing, pigmentation's reducing, and just overall skin health parameters have improved even just within a few weeks.
So is it a minimum of 3, or does everyone have to get 3? How do you do it in your own?
No, you don't have to get 3. Again, it depends on what your starting point is, I think. And also how much volume, if you're using Lenisna, for example, that you're trying to achieve. So some patients, if they're quite slight, they don't need much volume. They just need a little bit of a lift. So they might only need 1 to 2 treatments, especially if they're having combined treatments with something else, or if I'm layering Juvelook on top, because I'm stimulating the subcutaneous tissues and the dermis at the same time. And so it's having a knock-on effect, improving the skin from kind of like both directions.
Right. And how long do the results typically last for the patient?
About 18 months, a year to 18 months for Juvelook, and about 18 months to 2 years for Lenisna.
Okay. Sure. And how do they compare with the other options on the marketplace? I'm assuming you've sort of done some side-by-side comparisons, and this is your choice, obviously, but
yeah. So Sculptra obviously has the longest data behind it, clinical data, because it's been around for so long. And, that's around about 2 years. Radiesse, about 18 months. So pretty similar in longevity.
Mm-hmm.
If I can push you on that a little bit more, why would you choose Lenisna over Sculptra for that type of volumizing type result?
For me, it was the fact that I can reverse Lenisna if needed, and Juvelook.
Yeah.
So that safety aspect for me was important. The patient doesn't have to do any massaging or anything like that after treatment. The way the PDLLA works, so those kind of like 2 aspects of the lactic acid, the way it's more amorphous, it moves more fluidly, so it's quite good for highly mobile, flexible areas, so for the facial expressions, that kind of thing. So for me, because it has that more natural look to it, that's why I chose to use that product.
So one more question. It seems like you can use Lenisna in more places than Sculptra is, I guess, indicated for. Why is that? I mean, is that because it, like you said, it's a little bit safer, easier to dissolve?
Yes. Yeah, that, and because it's not that as crystalline, it's got that different structure. So it's not stiff and rigid to put in certain places. So again, it moves better within the tissues.
Yeah, right. And how much experience have you had in treatment areas outside of the face? Obviously, the neck's a big one that we talk about a lot. It's notoriously difficult to treat. What are the results like there?
Really good. To the point that, sorry, I'm stuttering about it, because the point that these patients that I would think you definitely need surgery, and because I've been doing some protocols and cases myself, I'm probably pushed the boundaries a bit on patients that I wouldn't normally do. Then I've actually been, whoa, this is crazy, and so even if they have that, prior, but the skin improvement, the tightening, the crepiness, has been actually quite staggering, to be honest.
Wow. So just to be clear, this is for necklace lines, crepiness, but not sort of laxity like turkey necks.
Well, I've got cases to publish. I'm just finishing them off, but a couple of them have got really, really saggy skin.
Right.
But I'm doing sort of split face, split neck studies, reconstituting sort of like a normal reconstitution, and then reconstituting with a product called NCTF to see if that has enhanced results.
Yeah.
And recording them, taking images, my skin images, that kind of thing. But so far, I've been actually quite surprised at what they can achieve in those patients. Right. And I'm talking like bad skin.
Yeah. I mean, our listeners will be well aware of NCTF. It's another product that I guess off-label You can inject it. Typically on label, it's supposed to be needled in. Is that correct?
You can actually inject it with, into the dermis. It's fine. You can use it as sort of like a mesotherapy technique.
Right.
So it's quite commonly microneedled, but certainly you can inject it.
And what does it have in it?
So it's 60 different ingredients. So again, it's got non-cross-linked hyaluronic acid, but it's got 24 amino acids, 12 vitamins, 6 minerals, 6 coenzymes, glutathione. So it's basically, again, part of that. If you're trying to regenerate things properly and you want that sort of pan regeneration or that Goldilocks zone, it creates an ideal cellular microenvironment and helps cell function essentially. So my thinking with using it with these products is that it will enhance the results that I'm getting because it's creating that ideal environment.
Right. Well, something that's all the rage at the moment is combination treatments and what can we do in a single treatment or on the same day. So what's Juvelook like or Lenisna like when you're combining it with things like toxins or devices, lasers? Is it possible?
Yeah, so you'd use, because they're broken down by heat, you'd use the energy device first and then you'd apply the Juvelook topically. So you can create, so if you're using something like radio frequency microneedling or kind of like fractional lasers, then you can rub the Juvelook on top, and because you've got the channels there created. And that actually works quite well, especially for acne scarring. Really, really good. So you can combine those. You can combine it with your toxin treatments. It's fine. Yeah.
So the particle size is actually small enough to fit through those channels. That's been some controversial sort of pushback on not this particular product, but other products around, are they actually big enough to fit in?
The Juvelook has the smallest particle size, 20 to 40 microns.
Okay.
And when you think of, even with microneedling or radio frequency microneedling, you're on average, you're about 100 to 110 microns with the little channels that you create. So, theoretically, it's they're small enough to actually fit through those channels. And even with normal microneedling, I've been trying it with that as well. It's not a recommended indication at the moment, but that's part of the protocol that I'm looking at and developing and seeing the results for that as well. So if we can microneedle it, then that's a bit of a game changer as well.
Cool. We kind of glossed over Juvelook for around the eye. I'm particularly interested for there. I've seen some pretty impressive results, and I guess I have to believe the before and afters because they look legit to me. But what's your experience with that? Because that's a very tricky area, especially here in Australia. Sun damaged skin, crepey skin. We're getting some good results with polynucleotides, but always open to new ideas. So what's your experience with that?
Yeah, it does work really well. And like you say, it's a tricky area to treat. I've treated patients from all sorts of Fitzpatrick type skin types with good results, from lighter to darker skin. Because it's anti-inflammatory, the way it works within the tissues when we switch that macrophage, it also helps prevent hyperpigmentation occurring, or helps control pigmentation. So I've certainly noticed it helps lighten that periocular area as well, which can be a bit of a challenge, as well as improve the skin quality.
So what tissue plane are you in when you're treating either tear trough or the skin itself? How do you do it? What volumes, what cannula?
Yeah, so 0.5 of a mil each eye with a cannula. I said 25 gauge or wider. And you just see the outline of the cannula. You don't see the graying of the cannula under the skin. So you're quite superficial. You don't need to be deep with it. And it just helps strengthen that skin, thicken that skin. And it gives some really, really nice results.
Yeah, I have to show you the results. They're pretty amazing.
Show me.
Actually, Lisa, I gather that when you went to do some training, were you in Mallorca or somewhere cool? Someone was filming you doing some. Oh, sorry, Lisbon. Someone was filming you doing some treatments. So maybe we could throw that into our Patreon.
Yeah.
Oh, Yes. Yeah.
Okay. We'll hopefully got something to show our Patreon members.
Yeah. So you mentioned safety data a few questions ago. So interested to know, can we explore that a little bit with the safety data on this product? Like how long has it been around for? How many treatments? Do we know how many treatments have been done? Obviously we've spoken about occlusions. Are there any other sort of issues, contraindications? Let's just talk about all the safety stuff.
Yeah. So contraindications, autoimmune disease, obviously not in pregnancy or breastfeeding, or if anybody's really got some serious sort of illness or metabolic disorder, I'd say. I don't treat those patients anyway. They probably wouldn't be coming to see me. But the product itself been around, well, they have been around since 2014. The product has been used in many countries since 2017, so quite a few years now. The side effects, apart from that, obviously the obvious one that we've spoken about, very transient. So it'd be like, little lumps and nodules, and that's because it's been injected too superficially, but treated with energy-based devices and settles completely. Transient issues such as bruising or discomfort from placement. But aside from that, there aren't really any, serious adverse events that have been recorded. And it's the most popular biostimulator used in Korea. I think it has something like 75 to 80% of the market share in Korea.
Right.
And so there's millions and millions of vials that have been injected with just a few cases of adverse events.
What do you think of this growing interest in Korean skin, Korean beauty, Korean aesthetics? It's very popular here in Australia. It's certainly trending, and some people are actually going, to Korea for like a little mini holiday stroke skincare journey. Did you see that in the UK? And what do you think about it?
People are a bit obsessed. Don't get me wrong. Obviously, I use this product and it's amazing. But I think, and obviously they're not subject, other countries aren't subject to the same regulations or restrictions and licensing practices as maybe, we are in the UK or certainly you guys in Australia. But I think, yes, there are innovative products from Korea, but we still need to be mindful and careful of products that haven't got clinical data. There's no research done on them, and we don't know the full effects of what we're using in some cases.
So what clinical data do we have for this product?
So there are quite a lot of research papers. I think there's like over 20 something now. I know that, because it's still quite a young product, but if you look, or I can certainly put them or send them to you to put in the IA library, for example, so people can read these papers to show the effects of them and comparing like for like with other products. So you can choose according to that, the data that you get just clinically and also kind of from a histological point of view. Compared to other products, I know there's another PDLLA that's being launched, and it's really hard to find. I could find maybe 3 papers, and one of those is a letter to an editor journal about their product. That comes up as a reference. So whereas these papers are actually quite robust scientifically, there's more and more and more being produced. And obviously I'm part of one of the groups that's leading the way on, developing protocols with different things. So when it's important to, get an understanding of the product that you're using and make sure it's safe to use.
Yeah. How many treatments do you think you've done now?
So I've probably done about 50 treatments now, I'd say, on my patients. So yeah, going well.
Yeah. So over what time span? So like when was your first patient?
So my first patient, where are we now? June, would have been February time, January, February. Yeah. So I still haven't got like the long-term data from them.
Have you had any feedback from your patients who, I guess, have experienced other similar biostimulators or maybe even hyaluronic acid fillers. Like, what's their feedback and their experience?
So the patients have been like actually very positive, the comments. So, I'd be getting messages like, people are saying how amazing my skin is. I can't believe how it looks. My redness is gone, or my skin feels really good. So sort of like subtle, you get the volume obviously over time, but people are noticing that things are changing within their skin, and obviously people that they know as well commenting on them, which is really nice to hear. I've not had so far, touch wood again, a negative comment from patients about the treatment.
Yeah. Now, from a practical or logistical perspective, how have you introduced this into your clinic? Because, whenever you introduce a new product, it's very hard to almost reinvent the wheel, because you've had other similar treatments previously, and then you're sort of introducing a similar thing. So how do you practically do that to get people on board?
So I start with we've all got the patients probably who would try anything. So I pick my audience first. I can cherry pick the patients who will be, they're okay. They know I'm probably having, obviously I consent them. They know I'm having to play around. They know that if one side is different to the other, I will put it right, while I'm developing some protocols and things. And so they're the ones that are kind of, I start with first of all. Staff members as well are a good one, because they obviously can talk to patients as well about the product. And then really just offer it as, we touched upon how confusing this sphere can be for patients and practitioners as to what to choose. And I think just by being honest with my patients about what product can achieve what, where we're treating, what indications that we're treating, and just give them the benefits. And I'm quite fortunate in the ones that let me kind of have a little play, for want of a better word. They're happy for me to use their photos to show other patients, so I can then educate my patients who might have a similar problem to those patients, what we can achieve, or what has been achieved in somebody in a similar situation. And I think that's quite powerful then, and patients can kind of like choose for themselves.
In terms of the pain level of having a treatment done, I've had polynucleotides, bit stingy, can be a bit stingy.
I thought you were pretty good.
Yeah, I didn't
There's
cry.
no screaming, no crying.
I didn't cry, no. So how does it compare pain-wise to sort of comparable products?
It's quite comfortable actually to place. If I'm injecting intradermally with Juvelook, because you can use needle with that. Obviously, the needle is a bit stingy, but the product isn't. So it's been quite comfortable for patients.
Okay. That's a good point, actually. I've seen the gun as well. So have you tried the gun? What do you think of the gun? Or do you still prefer handheld?
When I was earlier on in my career, I would probably use all the devices I could, probably because I wasn't as confident as I am now with needle, cannula. Whereas I've gone the other way. I've actually gone the other way. I find I prefer myself, my own injection techniques. And I think that comes with experience. So no, you don't need to buy an expensive device to deliver this treatment. What you have already in your clinics, you can use.
Fair enough. Now, in terms of cost, I don't know what it costs in the UK, so maybe not comparable in other countries or Australia, but what does it cost for, Lenisna, Juvelook, and how does that compare to the competitors?
Yeah, so it's actually on par, I'd say, with Julane, or maybe it's actually a bit cheaper, even though bizarrely it costs more to make a PDLLA product because of the D and the L isomer of the lactic acid. The actual cost per unit to the practitioner is less. And And so it's, the average treatment, for example, in the UK, per treatment, I think is around £600 for patients. I know products cost a lot more in Australia for you guys, but that's actually the patient would pay that. I think, you're looking at around probably £100 cost wise for the treatment.
Yeah, it's a nice profit margin.
Okay. And sort of what's the next frontier with where this product can be used potentially? Are there any sort of areas you haven't explored yet or things that, your research and sort of study is going to take you with this product?
So if from what I've been doing, we know that it's effective with sort of microneedling type techniques, that makes it an even safer product still. So that would be quite exciting. We touched upon dentists doing aesthetics. Apart from the hands and neck, I would not touch another body part because I don't think that's appropriate for me as a dental professional. So other people can probably explore that a bit more than me. But it's certainly quite exciting. And I know they are continually developing things at Vaim as well. So it's quite exciting, actually.
Yeah, I have seen some work on laxity for the arm skin, stretch marks, cellulite, all sorts of stuff. Yeah. So
the stretch marks data looks amazing. Yeah.
Yeah. So exciting stuff.
Yeah. Yet another great product that's, the potential to change the way in which we're practicing aesthetics, really. I mean, it seems we're moving more away from augmentation and more into bioremodeling, biostimulation, combining HA where you sort of get the best of both worlds. It's really exciting the way the industry's moving.
Yeah, Lisa, you said right at the start that you're sort of a regenerative aesthetic practitioner. What do you mean by that? And why have you sort of decided to do that?
I started with sort of like, again, the regenerative umbrella. Oh gosh, I'd say about when I was still doing dentistry quite a lot. I was doing dental implants and I'd use PRP for my dentistry and for my dental implants. And back then it's like you'd look, because things happen very quickly intraorally, and it was like magic happening in front of your eyes. It was like, whoa. But of course, we know it's biology, it's just sped up. And I started thinking about how I could use PRP because I already had a system in my clinic. And so I started treating hair, which seems a bit odd as a dentist to start with hair. And back then, there was not much data on clinical protocols. So I played around with protocols and did my own research. And I wrote a systematic review on PRPs in hair loss and found that kind of like comparable with the system that I was using was quite good. And I got some really good results because at that time there was not much data. And then I moved on to treating things like sun damage, subcutaneous atrophy from steroid overuse. I know, again, that seems a bit weird from a dentist point of view, but at that time I had one of my patients had overused topical corticosteroids on his arms for eczema, and he had really bad neuropathic pain, really thinned atrophic skin. So I said, okay, let's do a split arm study on him. He was at first. So I did intradermal injections in one arm, subcutaneous injections in the other arm of PRP, and the subcutaneous injections worked much better. And so that led me on my journey of looking at regeneration or stimulation of the subcutaneous tissues and how that might have an impact on the skin and regenerating tissues. As an aside, his neuropathic pain completely went. And I started looking more into also using these type of products for things like trigeminal neuralgia, post-herpetic neuralgia, neuropathic pain from dental issues, autoimmune conditions like things lichen planus, so, and that's how my journey started. And then as more things came into this sort of sphere, started adopting more and more products.
Yeah. Do you think we're still scratching the surface? Do you think we're just nowhere near the end. We're like, we sort of know some things, but we don't know a lot, right?
Yeah, honestly, it can be a bit mind-boggling and mind-blowing when you start. I find myself in rabbit holes sometimes. I sign up for alerts for papers, and then I'm walking the dogs for I know I've been walking for 2 hours because I'm like in this rabbit hole of paper after paper after paper. And if you'd have told me when I'd done my A-levels at school, why don't you go and work in a laboratory and count cells or look at what cells do, I would have been like, no. Whereas now, if I had my time again, or if I could do, I would definitely go and work in a laboratory.
Yeah, I've seen some of your comments about exosomes in our chats, and you know your stuff. So we might have to get you back to talk about another regenerative topic.
Yeah, absolutely.
But no, thank you so much. It's been a great chat, and always nice to learn about new products and see where we're going with this.
Yeah, to see the next frontier.
Yeah, and well, we're already there already. Yeah. There's just so many options.
Yeah.
It's getting super confusing.
Yeah, I've probably added to it now.
No, that's great. But no, thank you again, and enjoy your time on your holiday. And
thank you. Hope you get to Dubai.
Yes, I'm sure it'll be fine. And I'm going to be in London in October briefly, so maybe we'll get to catch up. I don't know if you're going to go to the A-list in Belfast. I'll be there.
I think I may be there, yeah.
Oh, all right. We'll have a Negroni in Belfast then. Fantastic.
Yeah.
Yeah. All right. Well, safe travels, and we'll speak soon, Lisa. Thank you very much again.
Thank you. Bye. Bye.
For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics.
Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.